I'm Carolyn Snow. I'm 68 years old. I'm a retired college professor. I live in Marshall, Texas with my husband David, and we have 5 children who are all grown and 7 grandchildren who are all nearly grown. Gonna have the 6th great-granddaughter within a couple of weeks. I worked as a social worker and a counselor. I taught sociology and psychology and criminal justice and social work. You know, over time you kind of figure out what you like to do, and I've always liked to fix things. I hate to see things wasted, and there's just more stuff in this world than you can possibly use, so we get both into the fixing and into the redistribution. In this particular town, like there is in many towns, there's a tremendous need for middle-income housing.
Yeah.
There's a lot of people who can't afford assisted living but are not ready for nursing homes, and there's a need for adequate housing. I'm not sure how many dogs we have. It changes every few days, but I think that on the place there are probably 7. And I don't know, they just I don't think we have any that have just wandered up. They usually have come as some part of some mission that they needed a place to live.
Every dog's got a story.
I remember when the doctor told me, he looked and sent me in for a diabetes test, and that's how I found out I had it. But my first thought was, good, I'll never have to eat any of that white icing on birthday cakes again. I don't know why on earth. I always hated that stuff, but I always felt obligated to eat a slice, and I've never had to eat another one. So I guess there's an upside to everything. One of the things I'm thankful for is insulin, because I feel like if I didn't have it, and that's where it plays into being able to get it and be assured of the supply, is that I wouldn't have survived the fluctuations of blood sugar. But my kids say that I run them crazy working, so I guess I probably still am able to do quite a bit.
Gosh.
And I couldn't if...
She's hard to keep up with, I tell you.
When Part D was coming up, I really wasn't very enthusiastic about what I heard about the development of it and how it was going to work. But I knew that I needed it because my other insurance was about to go away, and I was diabetic. I knew I would always need some kind of medication, and then there's the unforeseeable kinds of things. I anticipated that there would be lots of roadblocks or complications or slow pay or having to fill out a lot of paperwork. There's none of that, and it's done very well for me. It's paid like clockwork. It's done everything it's supposed to do, and very happy with it.